Again, yes. Thanks again, Chairperson. And I have nothing to disclose. So psychological stress can exacerbate symptoms of urinary bladder dysfunction in patients with overactive bladder or bladder pain syndrome. So we recently reported that Bombe, a stress-related neuropeptide, centrally induces facilitation of the micturition reflex in rats. Central bombacin is reported to induce responses to stress through brain corticotropin releasing factor, CRF, another stress-related neuropeptide. So in this study, we investigated whether brain CRF is involved in the bombacin-induced frequent urination in rats. This slide shows the experimental procedures. In urethane anesthetized male rats, bombacin was intracellular ventricularly, ICV, administered 30 or 60 minutes after central pretreatment with each CRF receptor antagonist. And the continuous CMZ was started 60 minutes before the administration of each antagonist. Then I'll show you our results. As shown in blue bars, centrally administered bombacin significantly reduced intercontraction intervals, ICI, without affecting maximal voiding pressure, MVP, in line with our previous reports. And the bombacin-induced ICI reduction was significantly suppressed by central pretreatment with astressine, a non-selective CRF receptor antagonist. In addition, central pretreatment with CP 154526, a selective antagonist of CRF receptor type 1, also significantly suppressed the bombacin-induced ICI reduction. However, pretreatment with K41498, a selective antagonist of CRF receptor type 2, showed no significant effect on the bombacin-induced response. At the end, we investigated effects of each receptor antagonist alone on ICI. As you can see, centrally administered astressine or CP154526 showed no significant effect on ICI. So in conclusion, our present data indicate that brain's CRF receptor type 1 is involved in centrally administered bombacin-induced frequent urination in rats. Therefore, this receptor subtype might be useful targets against psychological stress-induced frequent urination. Thank you for your attention. Thank you.
Questions?
Hi, Matt Fraser from Duke University. So you did continuous cystometry, and you have no any kind of measurement of voiding efficiency. So what do you conclude is the mechanism of action of the effect?
Well, so in our previous reports, we also performed single cystometry, and central administered bombacin significantly reduced the voided volume without changing residual urine volume or voiding efficiency. So bombacin might centrally facilitate the micturition reflex in the central level.
Okay, thank you.
Thank you.
More questions?
Psychological stress, there are animal models that show both increased urinary frequency. There are models that also show that it can lead to urinary retention. So that there are really different responses to different stressors and different strains of animals. I mean, it's a very complex type of response.
I think so.
So why the basis of using bombacin-based treatment or therapies?
Well, so as you mentioned, so the types response to stress is different, the type of stress. So, for example, the social stress exposure induced urinary retention. However, the psychological stress is reported to induce frequent urination. So in response to any kind of some kind of stress, the changes of neurotransmitter might be different in my image. So it's necessary to clarify so which neurotransmitters or neuropeptides are changed by each stress exposure, and then so we'd like to explore so which transmitter, which receptor can be a target against each stress exposure.
Well, just a question. Do you think that such an agent could be a single treatment for interstitial cystitis, as you suggest, or should it be combined with something? Because to me it sounds a little unreasonable that it should affect both pain and urination symptoms, well, with this particular mechanism. It's fairly, well, as I understand it, more that you regulate frequency than you regulate the main symptom of IC, which is pain.
Yes, so it's of course so that we use normal model in this study,
Yeah.
so just evaluated urinary frequency. So in future, it's necessary to evaluate in pathological models, so pain model or a stress exposure model, and then evaluate the effect of not only the urinary frequency but also the pain behavior.
Yeah, okay. Please.
Thank you. So I'm Hiroki from Bristol. So I just wondering about the action site, the particular action site of these drugs, because there is a lot of CRH positive neuron in cortex, brainstem, or cerebellum. So do you have any suggestion for the action site of these drugs?
Thank you for your question. So it's a very important point. But a limitation of this study that the drug was administered ventricular level. So it's a little difficult to discuss which brain region is activated by bombesin. So, but in our speculations, considering the distribution of bombesin receptors, at least hypothalamus or amygdala level might be activated. And then, so as you know, so these brain regions can innervate the midbrain PAG area, and PAG is a regulation center of Ponty micturition center. So maybe bombesin can activate the higher level from PMC and PAG, and then modulate the PAG activity, and then PMC activity might be changed by bombesin treatment.